America in the 21st century is a picture of diversity. So too are our schools. Not only ethnic, economic, and intellectual diversity, but also physical and psychological diversity. Since the passage of the Americans with Disabilities Act in 1990, America's schools now do a better job than ever of educating all children. It is the right thing to do, yet it is not without challenges.
Do you see anything there that...
How do our educators learn about the variety of medical conditions before them? The Epilepsy Foundation has made this video to help you learn about seizures in school.
I had a stroke in utero, which caused a brain injury. The brain injury caused my epilepsy.
Next thing I know, eyes roll in the back of the head, and he just collapses in my arms, and he starts shaking.
And in the fall, I hit my head on the granite and then on the hardwood floors.
It was just scary. It was a moment of panic. What do I do? When would it happen? Where would it happen again?
You worry about your kids, you know? You don't want them to be hurt, so you think about it a lot.
It's much more common than most people appreciate. Somewhere around 1 out of every 100 people in the United States has epilepsy right now. And somewhere between 3 and 5% of the population has had a seizure at some point in their lives.
Some people call epilepsy or seizures a brainstorm, a storm in the brain. But what does that mean? Well, it means that this normal activity where the cells are signaling from one to the next is basically doing it in an uncontrolled way. So it keeps going and going and going. Depending where in the brain that activity happens, your seizure looks different. It could be a repetitive thought, it could be a vision, it could be a smell.
It can also be the classic thing that people tend to think of when they're thinking of seizures, and that's the tonic-clonic seizure, or what we used to call the grand mal. It can also be, on the other side of the coin, what we used to call petit mal, where all we're seeing is an absence of a person. They just go blank for a moment, stare off, maybe a little bit of movement. And so we have the huge range from the biggest, the strongest, the most worrisome for most people, the grand mal or the tonic-clonic, all the way down to a little bit of movement or simply staring.
More than 300,000 students in the U.S. live with epilepsy. Working in the school system, chances are you'll encounter a student having a seizure.
When he started school was the biggest fear of my whole entire life, not knowing when you were going to get that call. And then she started having a seizure. We were pretty scared. So I sent some students down to the security office. I sent another student to another room to hit someone else's security button, and I tried to call the clinic. The clinic went directly to voicemail.
Attempting to get help is the right thing to do, but how can a teacher assist while waiting for help to arrive?
The first thing they should do is make the child safe. And so that involves making sure there isn't something near the child's head in particular, okay, that could produce some danger.
The next thing you do, if the person has glasses on, you want to take them off, loosen their clothing. If you can ease them to the ground, allow them to go to the ground, and then turn them on their side.
It's helpful to do that because what's often happening, and it makes people very scared, is that you hear guttural sounds, as though they're having trouble breathing. And so what you're trying to do is to allow the head to turn to the side so the saliva, okay, which the person isn't able to swallow at that time, can come out of the mouth.
You will want to get help. In the school rooms, they have buttons that you can push to get help. You can ask someone else to go get help. Call the health room. And if this is someone that's known to have seizures, they'll come with an individualized care plan, which will say if this person has medications or not.
Things not to do are to either put something in someone's mouth or think that they're going to swallow their tongue. The tongue is actually attached to some pretty big muscles in the throat. And so while patients may bite their tongues, they aren't going to swallow them. The more dangerous thing is that if you put something in someone's mouth that's rigid, they may crack a tooth. If it's something that's soft and they could potentially bite off, then the part that they bite off may actually be aspirated or go into their lungs.
Safety, clear the environment, roll them to their side, and then just stay with them and allow it to run its course. There is nothing that a person can do to change the course of that seizure.
A tonic-clonic seizure is not usually dangerous to the individual, but there are a number of points to consider when deciding whether emergency medical services should be called or whether the student should be transported to the hospital. Medical services should always be called for students having a first-time seizure. EMS should also be called under any of these conditions. The student is injured or has badly bumped his or her head. The seizure happened in water. The convulsive portion of the seizure lasts longer than 5 minutes. A second seizure begins shortly after the first concludes. The person does not regain consciousness within 5 to 10 minutes, or the person has diabetes or is pregnant. But if a student who is diagnosed with epilepsy has a brief seizure and has not injured him or herself, calling EMS may not be necessary.
When you know that someone has a seizure disorder, and someone has a seizure in your presence, whether it's a generalized tonic-clonic seizure or a different type of a seizure, generally speaking, you do not need to call 911 or rescue services unless the seizure is going on for more than 5 minutes.
When calculating the time, keep in mind there's always a period following the convulsions where the person is unconscious or extremely groggy. This is known as the postictal stage, and this time period is not included in the 5-minute calculation.
You may see somebody being very sleepy, really poorly, slowly responsive, and that would be described as the postictal stage. The seizure is over, and that's an important thing for people to understand, because the postictal period may go on for quite some time, for many minutes, even 15 minutes, 30 minutes. And in that time frame, that's not the seizure. So that doesn't mean, hello, the seizure is going on and you need to call medical services. You need to be there reorienting the individual, calming them, saying you know what happened and that they're going to be right back up and doing things shortly.
It's not something people need to freak out about, because chances are that person's had a lot of seizures before and they've bounced back every time.
Another common form of seizure that is not nearly as obvious is the complex partial seizure. Because only a small part of the brain is affected, a person may still be able to perform gross motor skills like walking or sitting upright, yet be totally unaware of his or her actions. They may stare, mumble, repeat phrases, blink excessively, smack their lips, or pick at their clothing. However, they will be totally unresponsive to instructions because their consciousness is severely impaired.
Let's say somebody were speaking to me. I might remember none of it,
Kevin,
a little part of it,
Kevin,
or it might be all jumbled together.
Kevin, can you hear me? Can you hear me?
It can look like something else. It can look like a student's not paying attention. It may look like a student is using substances they're not supposed to be using.
I think it's important that a teacher not assume that the student is simply not paying attention or is, daydreaming, that they understand it is possible to have these more subtle forms of a seizure where the mind sort of just checks out for a few minutes.
Their consciousness is impaired. It's not lost, but they're clearly not processing language, and they're not processing your intention. So that what you want to do is take harm out of their way